I think this is one of the most consequential offices in state government, particularly the last 2 years. We've really seen how significant this position is. You saw the Director of Health present at all of our weekly meetings with the governor, briefing Rhode Islanders on the state of the pandemic, how to protect themselves, what this means for the economy. So I think this is a really, really important position going forward, because even though the pandemic is trending downward, we have other emerging public health problems. And healthcare is a huge issue for the state, as we saw most recently with the proposed merger between Lifespan and Care New England. And the Director of Health has a significant role in issues such as that as well. Well, again, thinking back to the past 2 years, I think the ability to communicate effectively and clearly with the public is a crucial element. We really need a Director of Health who has the ability to really reach out, both via social media, via traditional media such as television and radio, and be a presence, to be essentially lead a public health conversation as an educator. We also need a Director of Health who can lobby effectively for resources. One of the challenges facing the state and indeed states around the country is that we've really underinvested in public health as a nation for a couple of decades now. We have a lot of attention focused on medical care, much less attention focused on public health. And so one of the things the new director, I think, really needs to do is to really lobby to help bring forward some additional funding and resources to address chronic health problems, not just COVID. We're talking about problems such as asthma and diabetes and cardiovascular illness. We as a state have an opportunity to really have Rhode Island lead the nation and be one of the healthiest states. But to do so, we really need to step up our investment. I think one of the most significant changes for the Director of Health over the past couple of years was in the visibility of the position. The Director of Health has often been in the limelight periodically, but what the public really saw over the past couple of years was almost a daily news conference or press conference that would really put that position front and center. And I think people really started to understand that health is interconnected to other things. The state of our economy, for example, was directly linked to decisions being made by the Department of Health about masking, about social distancing, about whether or not we can keep businesses open and how many people can be in businesses, et cetera. Those are all health decisions, but they have bigger implications for businesses and for really citizens across the state. The way I look at it, this position really affects each and every Rhode Islander in a very personal way. I think there's a number of things that the new director is going to have to wrap their head around. First of all, one of the biggest challenges is what's the future of the state's hospital industry. The proposed merger did not pass muster with either the Federal Trade Commission or the Attorney General, but that really just leaves an open question. What's next? And I think that question is going to land on the Director of Health's inbox as soon as they take office. Will Rhode Island, for example, welcome a for-profit hospital chain? Will we see an out-of-state suitor, someone like Mass General Brigham from the Boston area, or another out-of-state system coming into the state? Those are all questions that are going to have to be addressed within the Department of Health's review process. Another issue is, even though COVID is on the decline in terms of new cases, one of the things we're seeing nationwide, and actually we're seeing right here locally with the creation of a new center at Brown University focused on long COVID, and doing research into that, is that we have lots of folks who will be suffering the ramifications of this disease for years to come. We know that most people recover from COVID without significant complications, but for a significant chunk of those who are affected, COVID has long-term implications, and we don't fully understand those yet. And so that has implications for example, disability policy. Some individuals are unable to work. Some individuals have recurring long-term chronic health conditions, kind of akin to chronic fatigue syndrome or fibromyalgia. But the numbers we're talking about dwarf those conditions because of the prevalence of COVID over the past couple of years. And one of the other issues I think that is really front and center for this director, COVID really underscored the different impact of this pandemic on parts of our community, particularly communities of color. And health disparities really emerged as a key challenge for us over the past couple of years. It's not new, but COVID really brought it into stark relief. And I think the new director has an opportunity and really an obligation to really make addressing those health disparities a key priority. And to do that, we need investments. We need to do better, not just in terms of communicable disease like COVID, but in terms of chronic conditions. Because many of the folks who had underlying risk factors, that was one of those terms we heard a lot about, those underlying risk factors are much more prevalent in minority communities. And as a result, we saw much more significant rates of disease, more hospitalizations, more deaths in communities of color and in low-income communities than we did elsewhere in the state. And that's a huge challenge for us.